Hi, everyone, and welcome to In the News with David Lucas. I have some pretty nice developments going on, some exciting developments that are happening with COVID-19. I'll get to that in just a moment. If this is the first time that you visited the site, visited the channel, I'd like for you to subscribe, like, comment. This is a platform I created so that we can discuss what's happening in the broader sense of the African American community around the United States, and how politics and different things influence our community. I'm hoping to bring some truth to this platform so that all the mixed information or misinformation that's being put out there these days don't get circulated as much in our community. So, and also too, a lot of these news channels present this information, but they present it so quick and really don't break it down for how it affects our community. I'm hoping that we can change that and have some conversations about this information. Also, this is a commentary or a summary of things that I surmise. These are my opinions, but you're happy to join. I would love for you to join this conversation and give your feedback and input. Your input doesn't have to agree with mine. It's not that kind of a platform. You don't have to agree with what I say, but I'm putting out information so that hopefully it'll help us in our community. Tonight we're going to be talking about COVID-19, but not all the stuff that you typically hear about COVID-19 and what's going on. I'd like to tell you where we are. At the moment, we're about 4 months into the coronavirus as far as it, hitting the United States. Right now, unfortunately, we're about 91,000 deaths and over 120,000 cases around the United States. As we know, we don't necessarily have a tracking system. We don't necessarily have a plan for COVID-19. The United States president and the administration hasn't really come out with a developed plan for all of the states to follow. States are basically doing what they think is best, and unfortunately that doesn't always mean they're doing the best for the black community. So we're going to discuss that in different other forums, but tonight I wanted to come to you with some good news, actually. So I'm going to play a couple of clips for you that I found, and we'll talk about each one.
AstraZeneca, which is working with researchers at Oxford University, will initially supply 400 million doses and has secured capacity to produce up to 1 billion doses. Subject to trial results, first deliveries could come as early as September. I'm excited to say, joining us now, AstraZeneca CEO Pascal Soriot. Pascal, fantastic to have you with us, and congratulations on this deal. A huge bet from the United States on the success of this vaccine.
Yes, good morning, Julia. It is a bet indeed, but it's also showing that Warp Speed is working, and that the U.S. government, and in particular Secretary Eza, are leading. They are leading for the American people, but they're also leading the world. This is a bet, but if you look at it, the investment is absolutely worth it relative to the economic damage, the social damage, and the medical damage this epidemic, this pandemic is inflicting on everybody.
I couldn't agree more with you, sir. Just talk me through timings here in terms of deliveries to the UK, deliveries to the United States, and I mentioned the September date. How soon could we have substantial mass-produced doses in each of these countries?
Well, we will start getting substantial doses by September, October, and I would say about 30% of our deliveries will take place starting in September, October, and the balance will arrive by December, January. So a very, very short timeline, if you will, and lots and lots of people will be able to be vaccinated before the end of the year.
Wow. So based on that timeline and the numbers that we're talking about here, again, if this vaccine is successful, we could have the entire UK population, the entire US population potentially vaccinated by early next year.
Yeah, first of all, as you said, it has to work, right? I mean, so we should remember that it is, of course, not a guarantee that it will work. We have very good hope and we are confident there's good reasons for it to work, and that's why we are committing ourselves to it and moving so fast. But it has to work. And if it works, we'll be indeed able to vaccinate a lot of people. The truth is, you don't have to vaccinate the entire population. You tend to focus on the population at risk, the healthcare workers, the people who have underlying conditions, and then over time you can vaccinate a greater proportion of the population. And then you stop the disease when you get to about 2/3 of the population that is immune to this virus.
Developing herd immunity, to your point, you reiterated there a few times that this vaccine may not work. Can we just get a sense of, I know you're seeing human trials at the moment, we're then potentially talking about deliveries in September. Is that enough time between ending trials and getting these vaccines out for use? We're talking weeks.
Yeah, actually, we are actually trailblazing here because we are not following the standard process. We are partnering with regulators, both in the UK and in the US. We're working hand in hand with the FDA. We're sharing data on a day-to-day basis, on a real-life basis. And basically they're committed themselves to help look at our data as they come available, so that by the time we finish with our phase 3 program in August, they can rapidly approve the vaccine for emergency use.
Are you worried that we haven't, because of the desperate need, taken enough time to challenge the virus, to make sure that it's something that will work and that we can trust?
I would say we are not cutting corners. We are actually moving fast because of this partnership between the regulators and the Oxford group and ourselves. But we're not cutting corners. We're doing the clinical work that needs to be done. We've done the preclinical work. We're now doing phase 1, 2. We're going to do phase 2, 3. So it's a completely standard program. It just happens that it's done very quickly, with a lot of resources involved, a lot of passion, a lot of focus, and a great collaboration with the FDA in the US and the MHRA in the UK.
This is a global problem. You're talking about 1 billion doses, which is exceptional, but we have, just under 8 billion population. How does the licensing deal work? Can we see other big manufacturers around the world, Pfizer maybe, some of your biggest competitors, also ramping up production at the same time if this vaccine is successful?
Yes, but I think in this instance we are competing against the virus, not against each other. We at AstraZeneca are doing this as a for no profit, and I'm sure other manufacturers will do the same. And we need several vaccines, so we're not really competing against one another. We're really trying to bring several vaccines so we can vaccinate as many people around the world as possible. One vaccine will not be enough, number one. And number two, I think society needs to bet on 2 or 3 different technologies. So to hedge your bets and make sure at least 1, maybe 2, maybe 3 type of technologies succeed. So here we are really all trying to do the same thing, which is to bring a solution to this terrible pandemic.
So that's what I wanted to share with you tonight, is that, well, for you right now it's day. You're about 12 hours behind me. But what I wanted to share with you is that while all of this turmoil is going on in the United States, people are protesting, some are staying at home and some are not. The hospitals are struggling to keep up and trying to make sure that everyone is protected. The White House, everybody sees what's going on in the White House. It's a daily circus. So while that's going on, people around the world and the research community have been fighting to get a vaccine out. And while they've been doing this, what he's talking about here is, from what we understand, basically, and from my research background, I have a biology background and a clinical research background as well. It takes about 1.5 years, 2 years to get a vaccine of this nature prepared, ready to administer, bring to the front lines, start treating people with it. Takes about that amount of time. It's not because it takes that long in the lab, or it takes that long in the hospital, or it takes that long in the clinical trial. It takes that long because it takes so many different organizations to look at this data, look at this information, critique it, make sure it's sharp, make sure it's right, and then bring it and start treating people with it as a viable solution. It takes that long because all of these different organizations, whether it's the FDA or the different research organizations, have to make sure that it's safe for the public use. Okay, that's how we get all our drugs, whether it's in other countries like the UK or whether it's in the United States. We have safeguards and regulators to make sure that that drug is safe. I thought that the reporter asked some very good questions there, making sure, okay, we're decreasing the timeline to get this vaccine out. Have we given it enough time? The answer came that if this in fact works the way it sounds, basically day to day, these organizations have been working together to make sure that we have a vaccine that's safe. That basically, by the time the vaccine gets to the finish line, everybody's already looked at it. Everybody's already got the data in front of them. Everybody's already got everything they need to sign off and say, okay, we can start treating people with this. Okay? And in AstraZeneca's perspective, what they're looking at is once this drug is handed off to them, or once this vaccine is handed off to them, they can go ahead and start making it, manufacturing it, making it, and distributing it around the world. And why is that important? It's important because it takes organizations like AstraZeneca, Pfizer, Merck, all of these different big name pharmaceutical companies. They have already in place the tools to make this happen. Okay? They have the facilities, they have the workers in place that do this on a daily basis. They can fast manufacture this drug or this vaccine and get it out for public use right away. They can start putting it in the hands of the people who are on the front lines, the nurses, the doctors, the hospitals, the clinics, and start administering the first 30% or so of this vaccine that's going to be needed. Another great point that was made. Not everyone will need this vaccine at the same time. That's important. That's critical also. There's about 8 billion people. Okay? So that means that not 8 billion that need to be treated, but 8 billion in all. Okay? Not every one of those people will need this vaccine. But you got to consider the nurses and doctors who are on the front line. They see a lot of this. To protect themselves and protect their families, they're going to need some resistance to this. People who are already sick, of course, they need some resistance to this. Okay, so these are the people, and also people who have other types of disease that could cause them problems if they were to get this disease. They already have health risk already. So these are the people who would need to be treated first. I wouldn't fall in that category because right now I'm negative for the virus and there's no need to treat me right away for something like this. I don't have any outlying diseases that will cause me problems. I'm grateful for that, but I don't happen to fall into that category. But many people do. People have heart conditions. People have diabetes, different things like that. So they need the drug right away. So they would probably fall in the first 30% of people of the population of people that would get treated with this drug. So it's still in question. It's still going through the processes, but it's going faster than normal because everybody has their hand in it. So we're hoping, from what they're suggesting, we're hoping that maybe by September, October, we might have some vaccine solutions. Okay? As mentioned before, not all vaccine, this one vaccine probably won't work for everybody. So hopefully other companies will follow suit and have a different form of this vaccine that can be used in the hospitals as well. Okay? So all of that works together. All of that works hand in hand. What am I saying? Do we have this yet? Is it all finalized yet? No. But the United States has committed about $1 billion to this effort. That means that frees up a lot of people to focus on this drug and on this solution. So hopefully by September, October, we have some viable solutions. What does that mean in the meantime? What does that mean right now? What that means right now is we're not, as a country, ready to go back to work. We're not ready to open up the states. We're not ready to open up the churches. We're not ready to have big football games and all the things we would love to do during the summer and all of that. Businesses are starting to open up in the United States, but the United States doesn't have testing, tracking, isolation plans. We don't have any of those plans set in motion. Now, why is that important? A lot of countries have those things. They've used those things and they've worked to their advantage. They've gotten to a place where their cases are limited. They have a low number of cases. The United States is not in that position. So because of that fact, it doesn't make any sense for our politicians to be pushing to get everybody back to work, get everybody back to school, get everybody back in society, moving around, interacting with one another, when we don't know who even has the virus. So we don't know who has the virus. So if we're coming in contact with all these people, we do not have a vaccine yet. So at this point, we should still be isolating. We should still be staying at home. At this point, that's what we should be doing. Right now, the unemployment is about 40, last I looked, 40 million people applied for unemployment. Does that mean that 40 million people are out of work? Generally speaking, when they give those statistics, that means that it's more than 40 million people out of work. Why do I say that? Because there's self-employed people out there like I was who can't even apply for unemployment or employment benefits. People like realtors, barbers, some mechanics, different people, they don't apply for employment benefits. When their job ends, they don't get any money from the government. Okay, they just don't. Unless there's some kind of stimulus package, they don't get any additional funding. And many people in our community fall in that category. What am I saying? They're not getting any paychecks week to week, any of that. Their mortgage don't get paid, their car notes don't get paid, their bills don't get paid. These are folks who want to get back to work because they don't have an employer or the government sending them a check. And I understand that. I've been in that position. So I want people to understand that these people are motivated to get back to work. They're not sitting on their hands. They just can't do it. They can't do it because this disease is out there. There's no one to take care of their kids if they don't take care of their kids. The government's not doing anything to take care of them. So that's what's happening to most people in our community. Okay? And we're waiting for these so-called politicians to do something. But we watch them on TV and it's a circus. They're going back and forth and they're not even doing anything real to help the community. And that's where we are. So basically, we're kind of on our own. And most times when these situations happen, we are on our own. We have to find our own solutions. And that's why I created this platform, so we can discuss these things. And hopefully you can come in contact with somebody in the community that can help you get through these tough times. Because waiting on the government to do anything for us, we're the last people in the groups of people. We're the last ones to get a helping hand. And if you haven't lived long enough to know that, then keep living. Keep living. You'll figure it out as you go. The black community is usually the last community to get a helping hand from anybody. Okay? So, but as far as a vaccine is concerned, we're out to about September, October, or early next year. So, although that's some positive news, we've still got to get to that. So that means isolating and taking care of your families and doing the things you need to do, and not, I would say this point blank, listening to the White House, listening to these politicians about what they're going to do and aren't going to do, that's a bad idea for our community. I mean, maybe for some communities that's what they want to go with, but for our community, in my opinion, we've got to start helping each other and helping ourselves, because we can't depend on them for anything. Okay? I just read the other day where some politicians were trying to get some stimulus money sent out to everybody, and Mitch McConnell and those who can stop that from happening, the President of the United States who can stop that from happening, they're saying no rush. There's no rush to help people. There's no need to send stimulus money right now. For the people who are getting unemployment or employment benefits right now, because you're unemployed, Mitch McConnell said, when this series ends for you, there won't be any extensions. Okay? Mitch McConnell's, I think, out of Kentucky, and all this stuff lands on his desk. And he's the one that keeps anything that helps our community. He's the one that keeps anything that can help our community. He's not trying to help us. Okay? Lindsey Graham, Mitch McConnell, President Trump, I can name them all. Bill Barr, all of them. They're in cahoots together. They're not trying to help us in any kind of way. Okay? And there's a whole bunch of them. This is a situation, and this should be country over party. But right now they're playing party, Republican versus Democrat type of stuff. And at the end of the day, what does that mean? That means that our hands are tied. There's nothing that's going to happen in the federal government that's going to help us. I just don't see it happening. It's not going to happen. Now, recently, Pelosi, I mentioned that name. I should say the House Speaker. I think it's Pelosi. Did I say that right? I think I said that right. Yes. Okay. She has been fighting and got a $3 trillion stimulus package worked up and approved. Now, I don't know if that's finalized. I don't know what that means just yet. I'm going to look into that. That's something I want to look into. But if it's finalized, what it says is basically families would get kind of like a stipend each month for about $2,000 per parent or per person in the household, and I think it goes up to about $6,000. And there's some student loan forgiveness in there, and some other different things that she's using to help families out. I want to applaud that, because that's what we need. That's the kind of action we need right now to take care of families. Unfortunately, we don't get a lot of that, but I'm hoping that that'll be the next thing that they're working on, and they're trying to get that out to everyone. And I'm going to stop there, but I do want to say this. A lot of families was able to get $1,200 sent to them from the IRS as a stimulus, some money that was sent out. Okay? I want to clear this up. Donald Trump put his name on the check. For people who got a check in the mail, that kind of a thing. Donald Trump put his name on the check. This is a soapbox for me, personally. But I want to say this. That money doesn't come from Donald Trump. A lot of things happen so that that money could reach us, but that money does not come from Donald Trump. That money is yours. That money is mine. It's tax money that we already paid into the government. So when they send us these funds, that's not free money. That's money that came from the taxpayer. Okay? They get money as well from the taxpayer. They're supposed to be working for us. We don't work for them. We get that twisted all the time. That's a personal thing with me that bugs me. His name should not be on our check. When a check comes to me from the federal government, the IRS, or anyone else, that's money that I put into the pot that I got back. It didn't come from Donald Trump. So people who are out there on Facebook and others saying that that money comes from Donald Trump because his name is on the check. No, he made the people put his name on the check. But that money does not come from him. It does not come from the White House. That money comes from a pot of money that we've all put in. And they spend it like it's nothing on the military and all this other stuff that we don't need, instead of giving us the money when the money is there for us during a crisis like this. Okay, I'm going to jump off my soapbox, but basically that's it for tonight. I just wanted you to understand that there is a vaccine out there in the works. It's not ready yet. So we shouldn't just party like it's 1999, okay, and rip through the streets like we're crazy people. We still need to be washing our hands, taking care of our kids, doing those things, and protecting ourselves and staying healthy, because it's going to be a stretch before that vaccine is ready. And it's going to be a stretch, okay, for us, period, because still the hospitals, the nurses and the doctors are fighting to keep people alive all around you. You may not see it, because even as you go to work or do your normal thing during the day, you don't go to the hospital unless you're sick. But people who work in the hospital will tell you that those folks are fighting for their lives right now in your local hospitals. Okay? And many have died already. And you may not see it, and you may not want to see it, but it's happening all around you right now. And so protect yourselves, stay safe, stay healthy, take care of your family. Like and subscribe to the channel if you want to hear the different updates and different things I'm talking about in the community. There's a lot going on, but I want to thank you for having me, and I'll see